Soliman. All right. Hi, everyone. Welcome. My name is Kara Kaikini. I use she, her, hers pronouns, and I'm the executive director of the Maine State Breastfeeding Coalition. And before we get started with Dr. Soliman, I wanted to make a few announcements. First, we are excited that we are able to offer one nursing contact hour for this event. So in order for you to receive that contact hour, you must attend the full webinar and submit an evaluation. So we will have the evaluation option available for you throughout these intro slides, and also it will be sent to you by email after the webinar. And once we receive that evaluation, we'll send you the certificate of completion. And know that our webinars are recorded and can be found at our YouTube page. And for anyone who may have missed today's webinar but is interested in still watching it and getting contact hours, we are about to roll out how folks can do that. So stay tuned for that information. We just need to set up the payment option for them to pay the $15 for that CE. And again, once we receive your evaluation form, we will send you that certificate of completion. I'll drop the link to the evaluation in the chat momentarily. And also, our professional development committee will be meeting next week to review our speaker applications for 2026. So it's not too late. If you are interested in speaking at one of our webinars next year, we have 6 educational webinars, and we could potentially do more if we have the capacity to host that. So please submit your interest if you think that this would be a great fit for you. If you have any questions before filling out the form, then feel free to email us too, to check in about that. We want to take a moment to thank our annual partners, specifically our advocate partners, 207 Pediatric Dentistry, Maine Health, Martins Point Healthcare, and Riverstone Wellness. We are a nonprofit who depends on the generosity of these sponsors and on the generosity of our donors. So if you are interested in sending in a donation to support our work, we would greatly appreciate it. We just released our newest strategic plan, and we really depend on financial support and volunteer support in order to reach these goals. As we say, every drop counts. So if you can make a donation, please do. I'll put that link in the chat as well. And now it is my pleasure to welcome Dr. Shereen Soliman, our speaker today. Dr. Soliman is a pediatrician, neonatology consultant, clinical nutrition physician, and international board-certified lactation consultant with more than 22 years of global experience. A Harvard Medical School alumna and MILCC board member, she is internationally recognized for her leadership in breastfeeding medicine, neonatal care, and clinical education. Dr. Soliman has trained healthcare professionals in more than 25 countries across the US, Canada, Europe, the Middle East, Africa, Asia, and Australia, translating evidence-based research into meaningful clinical practice. She's the author of the Ultimate Breastfeeding Study Guide and a sought-after speaker at major international conferences, including ABM, ILCA, USLCA, Gold Lactation, UNICEF, and many others. And her work is distinguished not only by deep expertise, but by her ability to turn science into action and to elevate the care of mothers and infants worldwide. So welcome, Dr. Soliman. I'll stop sharing my screen so you can start sharing yours. Excellent. Thank you. Welcome, Dr. Soliman. I think you are off mute now.
Yes.
Okay. There you are. Excellent.
Yes, hello. Thank you so much. I'm really happy because this is the second time this year. And actually, as you said, I cannot imagine that it is December. We were meeting in April, maybe, or May. I don't remember exactly, but the year ended today. And this is my last event for the year with you. And this is a great thing to end the year with. I'm really happy to work with many states for 2 webinars this year. This show how lucky I am to be working with an advocate members who are supporting breastfeeding and supporting healthcare professionals in the breastfeeding and lactation practice. Today, I don't know if you see my screen or not. The screen is shared there. Yes, okay. So today we have a topic that's actually intersecting my work as clinical nutrition physician and breastfeeding medicine specialist or an IBCLC. And we know that there are a lot of trending dieting systems. The most widely known may be the ketogenic diet, the vegan diet, and the intermittent fasting. And you may check with mothers who are trying to lose weight. And we have, a lot of articles and papers talking about the dieting system while breastfeeding, and this is a different issue. Maybe we can cover it in a different workshop later, because this is a big issue for making a mother on a diet while breastfeeding. I have a lot to say about this, but let us say today about the mother who is following a vegan diet or a ketogenic diet or intermittent fasting. First, we will navigate the diet trends and we will give insight for the IBCLCs and healthcare providers to provide evidence-based guidance for the healthcare providers supporting breastfeeding mothers who engage in the popular dieting systems, especially those which we are talking about today, the 3 major diets or the 3 most trendy dieting systems. I'm sorry for that. The objectives for our session will be to define and differentiate these different diets, either the ketogenic diet, the vegan diet, and the intermittent fasting, and see how they affect the breast milk supply and how they affect the breastfeeding mother herself, and if they have an effect on the milk components or not. And then we will identify the management strategies to develop appropriate strategies to help the mother to go through successful lactation while they are following these trendy dieting systems. And also we will formulate evidence-based responses, because there are a lot of misconceptions about these dieting systems when they are followed by a breastfeeding mother, and depending on the age of the baby, with what is the age of the baby at that time. So first, the overview of this dieting system, we need to know that there are a lot of trendy dieting system that creates a critical gap in the knowledge of lactation consultant and healthcare providers dealing with breastfeeding mothers. So we need to emphasize the latest research offering practical help, which is based also on evidence-based information. We have a lot of dieting systems that are widely known all over the world. We have the Atkins diet, which depends on low carbohydrate diet. They usually are high fat, depending on 60% fat and 30% protein and 10% carbohydrate. And we have the South Beach diet, which focus on eliminating the trans fat and saturated fats for unsaturated fats and omega-3 fatty acids. We have the slim fasting, which is high protein diet with fibers and vitamins and low sugar. And we have also Nutri-System, which is pre-selected meals delivered to the house. We have Jenny Craig, which is pre-selected meals delivered to the house and meetings. We have Weight Watchers, which is point-based meetings. So there are a lot of names, and of course you have heard about the new medications which are available in the market now, like the Mounjaro and Ozempic, and how they are used by breastfeeding mothers or by the regular adult person, or even mothers in the childbearing period for weight loss. So today we will understand the landscape of each one of them. Ketogenic diet depends on a high fat, adequate protein with low carbohydrate, forcing the body to burn the fat for energy rather than the carbohydrates. And the vegan diet depends on the elimination of all animal products, depending mainly on the plant resources for their dietary intake. And the intermittent fasting depends on alternating between long hours of fasting, forcing the body to burn the fat for energy, and then take 1 or 2 meals per day. Let us have dive in each diet. What is the ketogenic diet? The ketogenic diet, as we have said, it depends on 70 to 75% fat. This is a high fat diet, and low carbohydrate, which is maybe about 50. It differs in different types of the ketogenic diets, actually. I would like to remove this to here we have 5% carbohydrates, and there are types of ketogenic diets which can increase the carbs to a little bit. And we have the proteins, which is 20% proteins. So this forces the body, this high fat content forces the body to change from burning carbohydrates to burn fat to get the energy, which gets the body in a state which is known as the ketosis. This metabolic state where the body is forced to get the energy from burning fat. So the classic ketogenic diet initially was created for the management of childhood seizures and epilepsy due to the ketone bodies, which appears to be the neurotransmitter modulation and the antioxidant effect on the brain. So first of all, this was used for us as pediatricians. We used this ketogenic diet for treatment of an epileptic child because this forces the brain to use these ketone bodies as a neurotransmitter, and this forces the body to have antioxidant effect from these ketone bodies. So the ketogenic diet has a 4-to-1 percentage of fat to combined proteins and carbohydrates. The amount of carbohydrates permitted is from 20 to 50 grams per day using low glycemic index diets. So adequate water is essential in every type of diet, and for sure you know this, not only the ketogenic diet, but usually we depends on the water because this is, the it may be the substrate which makes the physiological process all over the body works. So drinking water in any type of diet is very essential, and also to reduce the risk of constipation and affection of the kidney. The mechanism of weight loss with the ketogenic diet, as we have said, we are increasing the energy expenditure, increases in the sympathetic activity due to fibroblastic growth, and this leads to postprandial thermogenesis. Postprandial thermogenesis means that we burn the fat to get energy, and this leads to reduction in the appetite because the protein specific appetite suppression happens and non-specific appetite suppression happens. This means that when you are taking a lot of fat, this makes your appetite, you are not willing to eat protein because fat causes closure. It causes closure of the appetite of the body, and the reduction in the ghrelin, which is essential for the sensation of you feel there are two hormones, the ghrelin and the leptin. Ghrelin is the sensation of the appetite, and leptin is the sensation of satisfaction. So increase in also the glucagon-like peptide 1 and excessive water drinking, which leads actually to reduction of the diet, because actually when your stomach is full of a lot of water, this makes you willing to eat less. And a change in the lipid metabolism, reduction in the lipogenesis. So we are not making much more fat, but we increase the breakdown of fat, which is known in medicine as lipolysis, which is the breakage of this fat. And this greater metabolic efficacy in fat consumption for energy production. So we are shifting the body from the use of carbohydrate for producing energy to use the fat for producing energy. And then this causes the stress hypothesis for the islet cells of Langerhans, which are the cells of insulin, which leads to reduction on the load of the beta and alpha cells of the pancreas and leads to reduction in the insulin and the glucagon secretion. What are the limitations of this ketogenic diet? Psychological factor, because of the difficulty for adherence and the compliance from those who are following these types of diet, and the family and social support. And this is actually not limited only to ketogenic diet. If you are one of the members of the family and on diet, and you are sitting on the same table with the other members of the family, sometimes it puts on you some stress when you have different dieting plates from those around you. So this puts you on stress. The biomedical factor also, which is, it is not suitable for all persons, because as we have said, it was originated or invested for those children who have high electricity in the brain or hyperactivity in the brain, which is manifested as seizures or as epilepsy. So this was a current, some type of medication of the biochemistry of the brain to help decrease the electricity or the electric activity of the brain. So if the person is normal, he definitely will be affected by something like that. So it can lead to long-term effects. Definitely it can, but we have no research to document this yet until now. And actually, when you are taking so much fat and little protein and little carbohydrates, this means that it's not a balanced diet which is needed for a breastfeeding mother. So also from the side effects, actually, that it leads to what is known as transient keto flow. I don't know if you have heard from this expression, because of a disturbed body, a disturbed, dietary plan. It means it's equal for me into disturbed immunity. Disturbed immunity means common cold, means frequent infection, means to disturbed health of the body. So it involves brief from days to weeks period of adaptation, keto adaptation, when the body is making this transition from the carbohydrates to fat to be utilized as a source of energy. So the end result of this will be fatigue, lethargy, headache. So a breastfeeding mother who is feeling exhausted, actually she is exhausted from the responsibility of motherhood. You are overwhelming her with much more exhaustion, with much more fatigue, and also headache, and she have little sleep because of the breastfeeding sequence of the baby, especially in the first 3 months. So it doesn't go by mind, even without going through the research, it doesn't match a breastfeeding mother. Also, the adverse events in the short term include the constipation, low-grade acidosis, hypoglycemia, and dyslipidemia. And dyslipidemia leads to sequence of disease like hypertension, like cardiovascular disease. So if this mother is after the age of 40, this will be aggravated for her. This will be difficult for her body. Constipation can be prevented by the adequate fluid intake, and dyslipidemia should be prompted a shift to a less ketogenic diet when it happens. Dehydration and dyscholesterolemia also are other side effects of the ketogenic diet, which can lead to muscle cramps and arrhythmias, as we have said, disturbance of the function of the brain. And this also reflect all these side effects on a breastfeeding mother with disturbed rhythm, mostly with anemia, and a lot of, the vitamin D is extracted from her to be deposited in the milk. The calcium is taken to be deposited in the milk because this is fixed percentage in the breast milk. So it will be taken either the mother have sufficient calcium and vitamin D or not. So the end result is a mother who is suffering, but she still say, I'm okay, because she want to lose weight. It's not adequate for a breastfeeding mother. Supplementation with electrolytes like magnesium, multivitamins help to minimize these adverse effects. It will minimize, but not to diminish it to the level that it's not present. It will just lessen its effect. The long-term complications which have been found also from this ketogenic diet, growth in children, hyperuricemia, kidney stones, osteoporosis. So rapid weight loss leads to the formation of gallstones. And this is actually, when we are talking a breastfeeding mother in a vulnerable status, all these side effects are doubled. So what are the principles and effects during lactation? During lactation, this diet may affect the milk composition, because actually we know that the maternal diet, if the mother is not taking a healthy diet, the body will try to extract the calcium and vitamin D from the bones to deposit it in the milk, because we have fixed ratio in the human breast milk in all things like vitamin D, like the minerals, like the calcium. Maybe a little few elements are affected by our diet, and we will talk about this. What are the elements that are affected by maternal nutrition and affect the breast milk composition? So this will have an effect on the mother. The maternal energy balance will be affected. And also we have evidence suggesting potential risks for the milk supply reduction due to the energy deficit. The mother is not receiving enough caloric intake, and this will definitely affect her milk supply. You are trying to suppress by all means by this ketogenic diet and the ketone bodies which are deposited by this type of diet, by suppressing the appetite. Suppressing the appetite means lowering the intake. Lowering the intake means lowering the milk supply of the mother, because usually we add 400 to 500 calories more than the recommended dose for this mother. We add 400 to 500 calories per day for this mother when she is during the breastfeeding period. So you are reducing, not increasing, or not adding this extra amount. So definitely this will affect her exhaustion, her easyfatigability. She will not be capable to be coping with this, a little sleep, much effort, the new motherhood, all these will affect her. And beside also the lowering the milk supply. Monitoring the essential nutrients and the caloric intake is critical to ensure that the maternal health and adequate infant weight gain and nutrition and development while she is following something like the ketogenic diet. So what about the vegan diet? What is the vegan diet? It depends on removing all the animal-based food from the diet and depending on the plant resources only. So most of individuals who adopt the vegan diet, usually they do this for perceived health benefits or advocate for animal rights. Vegan diets usually refers also, they exclude all animal products. This include eggs and also the dairy constituents. So this means the removal of a great source of calcium and vitamin D from the diet. So we have different types of vegan also. Vegan who depends only on the plant-based resources, lacto-vegetarian, which depends on introducing of the dairy products with the plant resources, ovo-vegetarian, they eat eggs with the plant resources, and poultarian who eat the poultry with the plant resources only, but they don't eat the meat. Pescatarian, which depends on consuming meat or poultry. They don't consume meat or poultry or fowl, but they consume fish, seafood, eggs, and dairy products. So what is the effect of this on the body? We have a lot of resources in our body which is needed from the animal products, like the casein, like whey, like lactose, egg white, albumin, gelatin, a lot of things, vitamin D3, the omega-3 driven fatty acids. All these are present on the animal resources much more than the plant resources, or in a higher absorbable form rather than the plant resources. So mothers who will be following this diet will be they don't have all these resources in their body. This definitely affects the milk supply of the baby. So the food are emphasized in a vegan diet are rich in many nutrients like vitamin A, C, E, K, fiber, antioxidants, phytonutrients, which are present in the plant resources. But they are deficient in a lot of things like vitamin B12, vitamin D, calcium, selenium, zinc, iodine, omega-3, DHA, and EPA, which are essential actually in the development of the brain and the retina of the eye for the babies. What makes breast milk unique is these components, because they are essential for the brain development and retinal development. Even the formula companies they do a lot of effort to make this sensitize the form, but they never match what is present in our human breast milk. Therefore, supplementation for these nutrients is essential when a mother is following the vegan diet. A vegan diet has been linked to lowering the risk of disease like heart disease, type 2 diabetes. Like we have said, the ketogenic diet was invented with the aim to treat children who have hyperactivity or higher electricity on the brain, leading to convulsions or epilepsy. The same like vegan diet, it has been used in medicine to lower the risk of heart disease, type 2 diabetes, high blood pressure, certain types of cancer, and obesity. This is proved by research that it lowers actually these type of disease, and lower than average rate of cesarean section and less postpartum depression, with lower neonatal and maternal mortality during pregnancy if the mother is vegan during pregnancy, and increase environmental sustainability because of the plant food production. This required natural resources than animal food production. So this works through lowering the cholesterol, lowering the blood pressure, lowering the BMI, because usually the animal products contain high cholesterol, which can lead actually to deposition of this cholesterol in our blood vessels, and this leads to narrowing of the blood vessels. Narrowing of the blood vessels means high blood pressure. A deposition of this cholesterol will be converted into fat, means deposition. This deposition leads to increase the BMI. So some sort of lowering these factors can be through depending on the plant resources, avoiding the animal resources which have high cholesterol. In fact, vegetarian diet and vegan diet has been effective in treating coronary artery disease for over than 45 years. Research suggested that a well-planned plant-based diet is equally as successful as lowering cholesterol and as a statin medication. And we know that statin medication have a lot of side effects, because myself, I tried to follow, I have high cholesterol level. When I was instructed by my physician to use the statin, it leads maybe to the muscle itself started to lower down, I feel that I'm losing my muscles without making anything. The statin have very, very bad effect on our muscles. This may be not all persons, but this is recorded in research. So when you use a low vegetarian diet for replacing this high cholesterol animal resources, it would favor this condition. Improving the glycemic control compared to the conventional diabetes diet in individuals with type 2 diabetes. There were also a randomized control trial which found that vegan diet were associated with improved glycemic control. This means that the hemoglobin A1C decreased by 0.36%, which is very, very considerable, more than a conventional diabetes in a diabetic diet in individuals with type 2 diabetes. So this is considered also in mind when you are following a vegan diet. A 74-week also RST, also a sample size found that a low-fat vegan diet appeared to improve the glycemia, the plasma lipids more than the conventional diabetic diet. So this means that it is recommended for people with type 2 diabetes, and reduce the overall cancer risk actually by percentage according to a series of randomized control studies, which are several in front of you from the recent and the old, by 15%, which is also considerable percentage. So some data suggest that these vegetarian and vegan diet may be at increased risk of increased homocysteine levels and increasing the risk factor for cardiovascular disease later on, but not like the animal resources, and low bone mineral density because of the low vitamin D3 and low calcium. If they don't take this supplementation, this will definitely affect their bone mineral density, leading to osteoporosis. The plant-based diets are reported also to have low content of essential macronutrients like vitamin B12, like iron, like zinc, like vitamin D, like omega-3, calcium, iodine. All these can lead to adverse effects. So when all these elements are deficient in the mother who is breastfeeding, would you assume that she have, a normal baby who is developing healthy? Let us see. So vegan diets during pregnancy, it have been found that, as we have said, it lowered the incidence of, preterm labor, and following plant-rich diet during pregnancy protective against the development of preeclampsia, pre-gravid obesity, and minimize of the exposure of genotoxic agents. And also it leads to the lowers the incidence of pediatric disease such as wheezes, diabetes, neural tube defects, orofacial clefts, and some pediatric tumors. The health benefits of the vegetarian diets in the pregnancy includes also lowering the excessive weight gain. And for me, as an IBCLC, excessive weight gain means lower milk production, because actually the fat cells have leptin and melatonin stored in it, and both are inhibitor for lactation. So I wouldn't recommend that a mother who is willing to breastfeed to have higher BMI or to have increased body weight. So I would prefer, if she have time to plan before pregnancy, to lose any extra weight. Dietary patterns that are high in plant food also are associated with decreased risk of gestational diabetes, hypertensive disorders of pregnancy, and preterm labor. So what about lactation? The vegan diet excludes all animal products. So as we have said, there will be a lot of elements deficient in this maternal body. And this means that it will be deficient in the breast milk, and this means that it will affect the growth of the baby. Supplementation and dietary diversity can support breastfeeding mothers' nutritional needs, and also understanding these considerations allow us as healthcare providers and IBCLC to guide a mother who is following a vegan diet. What is the essential supplementation? What are the essential resources of these deficient elements to be taken from the plant resources? So the vegan diets during lactation, the average birth weight of infant born for vegan mothers doesn't differ significantly from those of the omnivorous mothers. But the macrobiotic vegan women, whose diet can be highly restricted in calories and nutrients, in contrast to the well-planned vegan diets, give birth to infants whose weight are significantly lower than the expected. So breast milk of vegan also is deficient in vitamin B12, which is essential for the neurological development. This can lead, even in severe cases. I have read a case that the mother was vegan and she was not taking the supplementation of vitamin B12, and actually this led neurological symptoms for the baby. Can you imagine this? So according to the American Dietetic Association, well-planned vegetarian diet are safe for all ages and in the physiological conditions like childhood, adolescence, pregnancy, and lactation, but with precautions. On the contrary, the German Nutrition Society doesn't recommend these vegan diets during pregnancy, lactation, or childhood due to the inadequate supply of nutrients. So the third type, what is the intermittent fasting? It's like, eating a pattern, not a diet. It's like I make a schedule for my eating plan during the day. It means that I fast for 16 hours and eat for 8 hours. And during these 8 hours, I may take one meal or two meals. No consumption of the food from the previous day. Maybe I plan from 8 p.m. until the next day, 12 p.m. It's like fasting in our religion. In the Islam, we fast from the 5 a.m. or 4 a.m. till the next day, 7 p.m. or 8 a.m. But is this appropriate for a breastfeeding mother also? Let us say. But during the fasting period, we are able to drink and take black coffee and black tea. This is accepted. We have common types of intermittent fasting, which is the 16-8 method, fasting for 16 hours. For example, only eating between noon and 8 p.m. and drinks are allowed in between. Eat stop, which means once or twice a week. And I don't eat anything from dinner one day until dinner the next day at 24 hours fast. This is one type. Is this suitable for a breastfeeding mother? I don't think so. Then the 5-2 diet, which is during 2 days of the week, I eat only about 500 to 600 calories. Let us think that most of the mothers in the childbearing period are between the weight of 60 and 80. This is from my work in the clinic. This is the average weight I see, from 60 to 80. So this means that the recommended dietary or the RDA for this mother is usually not as a human being, as an adult, not as a breastfeeding or as a lactating mother. It will be like 1,800 calories, okay? 1,800, okay? And we increase this for the pregnant or lactating by 400 or 500 to 1,800 plus extra 500. This means that her diet shouldn't be less than 2,200 to 2,400. Compare 500, 600 per day with 2,200 to 2,400. So it means that she is taking beyond half of the nutrients which is required for her as a breastfeeding mother. The ADF, which is alternate day fasting, don't eat for 24 hours, one day completely, followed by a fed day with no intermittent fasting. Also, this is deteriorating for a mother. I don't imagine a mother who is fasting for 24 hours without anything to eat or any source of energy. What happens is, even for us as clinical nutritionists, we say that if the mother loses a lot of, more than 5 kilos in 1 week or more than 3 kilos in a week, this leads to the breakage of the fat cells. These fat cells store the toxins that we receive from the surrounding environment. So this means that these toxins will be released in the body from the broken fat cells, where they go to the maternal plasma and from it to the breast milk. So rapid weight gain is not recommended during breastfeeding because it allows the toxins to be transferred through the breakage of the fat cells into the body of the baby through the breast milk. So this is a diagram also for the types of the intermittent fasting. What is the health benefits of the intermittent fasting? It supports cellular repair and energy regulation. A meta-analysis suggests also that it may improve the metabolic health, and some research also say that it lowered the overall mortality. It's a high boost, it gives energy. It's actually, I'd like to say that this is in the general because every type of these diets we are talking about today have some benefits for special category of people or a special disease, like the ketogenic diet for epilepsy, like the type of diet of the vegan diet, which is more suitable for diabetogenic or for diabetic patient, especially type 2 or high cholesterol patient. And this intermittent fasting, I would say that it's very amazing in, the immunity and health of the body, boosting the immunity and the energy expenditure for the body for those after the age of 40. because it makes you feel like you are really healthy. It corrects something in the body that's not known till now, but it helps fat loss. It makes boost for your energy. It makes autophagy, which is the kill of any antioxidant. It works like antioxidants in your body. It has anti-inflammatory effect. It leads to improvement of the cognition of the brain. It leads to improved insulin resistance. It prevents also when we have a lot of toxins in the body, it helps the body to get rid of these toxins. So these are very amazing effects for those after the age of 40. I usually recommend, if she is not a breastfeeding mother or a pregnant mother, I would recommend for her to follow this intermittent fasting, maybe twice per day, or maybe through the month. Every month we can follow it for a limited number of days. So what about the potential risks and side effects? Every type of diet have, beside the positive points, have side effects. Intermittent fasting is very, very hazardous for the pregnant and lactating and children and older adults, because they need resources of energy. Older adults means that when we are talking above the age of 70, the elderly, it's not recommended for them. Lowering the blood sugar and hypoglycemia. This is one of the causes, because all these categories, the pregnant, the lactating, the children, elderly, when they have low blood sugar, this can lead to the hazardous effects on the brain, actually, and can lead, to severe hypotension to the level of death. So take care of this. So mood disturbance and fatigue. We can say that fasting-related fatigue often come with irritability and mood swings, and this happen, as we said, in every type of diet. So for this type, any type of diet, I would not recommend for a breastfeeding mother, because actually she have her own mood disturbances. So I will not overwhelm her body with much more disturbing factors. Eating disorders and disordered eating. Sometimes, this fasting for a long time of hours can make your body have a reverse reaction. So you eat much more than the recommended. So sometimes it depends on the reaction or how you react to this intermittent fasting. So you should keep an eye on this. So what about the physiological impact on milk production? Intermittent fasting involves cycling between eating and fasting. During lactation, this pattern influences the milk volume and nutrient transfer. And this is actually what we say during fasting, during Ramadan, Islamic fasting for the Muslims. When mothers come to the clinic asking, should I fast or not? Because we fast actually for about 18 hours, and depends on the country where you are. Sometimes it's prolonged. I know my friends in other countries abroad, they fast for 22 hours. So, but they are deprived even from fluids. It's not fasting in the Islam doesn't depend only on preventing food. No, it also you prohibit water. You don't take any water. So this means that dehydration, and we know that breast milk is about 87 to 88% water. So you are depriving the body from hydration. So how will this mother be capable to make milk beside the exhaustion? So during lactation, this pattern will definitely affect the milk volume and the nutrient transfer. Research indicate also that possible temporary reduction in the milk supply and the maternal energy fluctuations. Careful monitoring is essential to balance maternal health with maintaining adequate milk production if she is insisting on using this way of dieting. Also, pregnant or breastfeeding individuals need more nutrients, as we have said. So how would you lower this caloric intake to 18 hours or more, or 16 hours? It's more than extended than a mother can withstand. Generally, pregnant or breastfeeding mothers are advised against intermittent fasting. So how maternal diet affect breast milk quality in general, not the maternal dieting itself. Usually we have a lot of products in our milk, human milk, oligosaccharides, minerals, vitamins, water, hormones, growth. It's a multifactorial biochemistry in our breast milk. So the macronutrients like fat, proteins, and carbohydrates are not affected by the maternal diet. However, the fat is one exception to this principle. The human milk fatty acid profile is affected, the profile, not the amount, is affected by the immediate diet consumed by the mother. So maternal diet actually doesn't change by the quality, but not the quantity of the fat, as we have said. So the influence of maternal diet, we can say that we have no or little effect on the major component like carbohydrate, like fat, like proteins, but the profile of fat differs according to the type of fat that the mother receives. However, we have the mother milk supply is not affected directly with the milk supply, but it is the exhaustion which results from decreasing the energy which the mother gets from her diet, carbohydrates, proteins. However, water-soluble vitamins are affected by the maternal diet, which is vitamin A, vitamin C, and B. And the B is, a matter of risk in the vegan diet. The fat-soluble vitamins, which is the ADEK, ADEK, are not affected with breast milk. And this one of the mercy that God have on us, because these elements usually are present in the animal resources and the plant resources. And the minerals also are not affected by the maternal diet. So the impact of the maternal vegan diet on the human milk composition is the deficiency on the vitamin D, the calcium, the iodine, the omega-3, and vitamin B12. Therefore, when you have a mother following with you and she is on vegan diet, you should usually take care of these elements as supplementation and also added as resources from plant resources. So we can consider that in general, the vegan diet can be safe if the mother still breastfeed with taking the supplements. So what are the supplements that you should give to this mother? You should be consuming sufficient calories, which means that her caloric intake should never be less than 2,200. You should add to the mother. I will go through this quickly because I want to know supporting breastfeeding mothers on alternative diets. How would we support this? Potential nutrition deficiencies in the breastfeeding mother. We have the vitamin B12 deficiency for the vegan. So this is crucial to be given as supplementation for the mother. The DHA with the vegan diet also. This is essential for the brain development and the eye development, the retinal development of the baby. So you should take adequate amount. We have even if she have no fish, if she doesn't take the fish in her supplementation, there are other sources like the nuts are full of the DHA. We have the olive oil. 1 spoon of olive oil can give her requirements of the DHA. Also calcium. There are animal resources. There is also plant resources for the mother who is following the vegan diet, and the energy imbalance for all. This is inadequate caloric intake can affect the composition or compromise the milk supply for this mother. So effective supplementation, dietary planning are crucial for a mother when she is following a special type of these diets. The key nutrients to monitor here for the vegan mother is the iron, the vitamin B12, omega-3, calcium, vitamin D, and selenium. So we have resources for omega, like which is found, the omega-3 is found in animal resources like chia seeds, flax seeds, hemp seeds, tofu. Also, selenium is found in Brazilian nuts. Also, we have the vitamin B12 is found in fortified plant milk for the veggie, and also supplements as supplementation and the nutritional yeast. And actually, yeast can boost the milk supply. It's one of the things that we use in the dietary plan to boost the milk supply of the mother. The iodine is found also in the iodinized salt and nori paper. So many people still believe that milk and cheese are the sole sources of calcium, and anyone who doesn't consume them will be at risk for brittle bones. And simply this is not true, because it's just the idea that they are more bioavailable than those from the dairy products without the cholesterol or saturated fat. The plant-based calcium turned into cooked colored greens, fortified foods like soy milk, like orange juice, like cooked white beans. So all these are resources, plant resources of calcium. So the best vegan resource of calcium, we have a lot, like the orange juice, the soy milk. This is as an example only. The tofu, white beans, dried figs, tahini, and tahini boost a lot the milk supply, by the way. So each one, cup of soy milk, or 368 milligram of soya beans can be equal to 1 cup of milk. Orange juice and colored green also can be supplying nearly 1/3 of the way your calcium goal or what you need of calcium. The tofu, the white beans, the dried figs, tahini, as we have said, the sesame seeds, which are usually, if a breastfeeding mother wants to boost her milk supply, I advise her to take the sesame seeds, by the way. So don't pair with calcium when food that are high in calcium will inhibit your body from absorbing the iron resource. So don't pair the iron resources with calcium resource in the dietary plane to make benefit from both calcium and iron that is given in your diet, or even if they are taken as supplementation. Pairing vitamin C resources with iron resources help also the body to absorb. And this is one of the miracles of breast milk, that the iron which is present in our breast milk is adjuvant with, or is present with vitamin C to enhance its absorption. This is why the breast milk have we have little amount of iron compared to the formula, yet they are much more absorbable. Our iron, the iron in our breast milk is absorbable by 90% compared to the formula, which is absorbable by 10% or even less. Adding vitamin C to the meal increases the body's ability to absorb up to 67% more iron. So pairing avocado with Swiss chard, a baked potato with broccoli, these are examples for, something to pair with to get both together. Pure orange juice with toast, also frying tofu with red and green peppers and broccoli, also fruit salad with kiwis and strawberries, and cantaloupe with oatmeal or high iron cereal can help. Beans and rice with salsa and falafel and tomatoes. Also hummus, which is the peas with the lemon juice. This can help also take the needed amount of iron with the vitamin C. So intermittent fasting and lactation. We have limited evidence research on the intermittent fasting during lactation are rare, but we have potential risks which include dehydration, fatigue, reduced the milk supply if the caloric and the fluid intake are not sufficient for a long period of time. Prioritizing hydration and the calories is important for those mothers of intermittent fasting, which I see that it is against the idea of this type of fasting at all. So addressing misinformation to empower IBCLCs, we need to know that fasting increases the milk quantity. This is a myth, not fact. False, because we monitor fluctuation that can occur, and the caloric restriction or dehydration from fasting is more likely to negatively impact the milk supply of the mother. One of the methods also that keto diets deplete the milk supply, not necessarily, but you need a lot of adjustment to be made to the diet. Vegan diets are always healthy for breastfeeding mothers. This is not true, because you need a lot of things to be followed up and monitored for the breastfeeding mother and her baby. Counseling technique for these misinformation and methods. Health providers must address the common methods such as fasting improve the milk supply, keto reduce the milk supply, with clear evidence and communication with the mother. Employing empathetic counseling, and this is part of our work as IBCLC, with the up-to-date research empowers mother to make informed decision. And this is our role as IBCLCs, to help the mother take the informed decision based on the information that you have given her, which is evidence-based and up-to-date. Practical approach to safe weight management in the lactating mother. Safe weight management is essential because strategies could include caloric reduction with nutrient-rich food choices and regular hydration. Monitoring the maternal and infant health is crucial in this case. So what are the general recommendations that can be given for weight management away from these dietary trendy plans? Consuming enough calories. Never underestimate the value of these extra calories, but add them in a healthy way that can be burned with lactation, because usually we add 400 to 500 calories during lactation and during pregnancy, but the body burns, usually if you are a full breastfeeding mother, the body will burn 500 calories. So it means that what you intake will be burned with the full breastfeeding. So this should be also told to the mother to feel that she is taking what she can make the milk from. It's not like that, but I mean to make it simple for the mother. Get the right nutrients. And instead of taking these calories of the candies and a lot of carbohydrates and a lot of rice and a lot of pasta, I can take a lot of protein, a lot of fish, a lot of sesame seeds. And instead of taking a lot of sugary products, you can make it in the right way. Plenty of vitamin B12 is needed if you are insisting on this type of the vegan diet, and the calcium also should be monitored. Taking the needed supplements, because if you are the mother, after her informed decision by the end of the counseling, was to take these or to follow these types of diets. So you are obligated to let her understand what are the supplements that she must never miss. It's about the compliance of the mother. It's about to know the responsibility that she have, because this can affect her baby actually, especially vitamin B12 and vitamin D. Stay hydrated. It's important to drink plenty of fluids whenever you are a breastfeeding mother. Drinking plenty of fluids is a must. Variety of foods. So we can use lentils, dried fruits, meat substitutes, nutrient-dense foods. This can help a lot for a breastfeeding mother. Try vegetarian lactation bars, which depends actually on oat, fenugreek, fenil, yeast, and spinach. This can be boosting your milk supply in the way that you love in your vegan style. So the key takes here: guiding a mother with confidence is essential, evaluating nutritional adequacy, guiding her to safe weight management, and combat misinformation, equipping the IBCLCs and the prenatal professionals to provide optimal care in an evolving dietary landscape is important. Our conclusion here is supporting the breastfeeding mother, whether they are on ketogenic diet, if this is in her informed decision after all the counseling that you have said. So follow up the baby, follow up her milk supply, close observation of the serum levels of the vitamins and minerals in her body. Evidence-based counseling help to dispel the messes and promote safe practice. Prioritize in every step the maternal and infant well-being, which ensures successful lactation along diverse dietary preferences. Thank you so much. I think exactly we have finished the time.
Oh my gosh, that was so excellent, Dr. Soliman. So much really.
Thank you so much.
So we have a couple of questions in the chat. Candy asks, you mentioned sesame seeds can increase breast milk. Is
Yes,
that
yes.
on vegan or intermittent
In
fasting?
general, it's amazing for boosting the milk supply. Actually, it is tradition here in Egypt and in the Arab world that they eat tahini, but actually I usually instruct mothers. It makes a lot of fat in the body, so I usually instruct to take the raw sesame seeds. The raw sesame seeds are amazing in boosting the milk supply.
Okay, great. And then Gina says, my experience is that with the diet approaches in particular, there's underlying ideology which can be more of a problem than the actual nutritional needs. What kind of communication resources do you find to be most effective? For instance, many vegans are incredibly knowledgeable about their nutritional needs and are not
Yes.
looking for this kind of information from lactation care, but they may have opposition to animal-based supplementation for infants in the case of milk insufficiency.
No, it is in cases of vegan diet, it's a must for the mother to take the supplementation, whether she is convinced or not. It's a matter of health of the baby. We have cases because the mother doesn't take the vitamin B12 supplementation, the baby have neurological symptoms. And this is recorded in a lot of researches in the PubMed. You can search for it. The effect of the vegan diet, prolonged vegan diet without sufficient supplementation of vitamin B12 can lead to symptoms in the baby, neurological symptoms. And actually, this happens when the bariatric surgery, that the bariatric surgery, they cut part of the stomach, which produces vitamin B12. So they are usually instructed to take vitamin B12 for life. Actually, these mother on bariatric surgery, they are, they have no choices actually, because it will definitely affect the health of the baby.
Okay, great. Gina, I'm not sure if that answered your question or if you had any more you wanted to add. Feel free to go off mute or add more in the chat. I'm also wondering if you have any information about the GLP-1 medications that.
Definitely, yes. The GLP-1, I have a conference about this year. Actually, what we have in research till now, that it is affecting the animals. The clinical trials that have been done on the GLP-1 say that it actually affected the mammals like the rates and rodents. The babies were affected by the GLP, but till now we have no clinical trials in the human being that say that it affect the baby, but it affected the rodents. you know.
Mm,
So up till now, it is still under research, but we can say that we must counsel the mother about other options because the GLP-1, we have Ozempic and we have Mounjaro. Also, one of the things that we were discussing recently is that one of the cases when she was following for Ozempic, she found that the oval count was decreased when she was on Ozempic versus Mounjaro. So she had been following the ovarian count or the count of the ova. They found that the Ozempic affected the fertility. So
interesting.
they are still risky.
Yeah, we look forward to
And
more
also, you have
research on.
metformin. You have metformin. This is a safe, if you are talking about, that the use of the GLP-1 was not only for the weight loss, it was actually for type 2 diabetes, for the management of type 2 diabetes. So if the mother is diabetogenic or diabetic, you can use metformin. It's much more safe, have high molecular weight, never pass to the breast milk. So we still
Mm,
have options. You still have to counsel her about, yeah, I know that Monjaro, she can lose 12 kilos in 1 week. We see cases like this. But take into consideration that the fat cells will be broken with all the toxins released to the body and will go dive through the maternal plasma, reaching the breast milk. This will be poured into the brain of the baby.
mm,
It's
yeah.
not accepted.
Yeah. Yeah, I look forward to more research to guide folks
Yes,
and
definitely, yes.
it's always nice when there's research on lactating people and not it doesn't happen that often, unfortunately, but I hope to see more research on that. Well,
Yes,
this,
they dive in this and you will find a lot of things written.
yeah. Does anyone else have any other questions? Feel free to go off mute or type in the chat. I don't think I missed any. I also had put
Thank you,
in
Jessica.
that I'd just seen yesterday. I think Laurel Wilson had sent it in her newsletter about the effect of consuming diets containing beef compared to plant-based beef substitutes on milk composition. It's
Yes.
really fascinating. And it's also one of those topics where you don't want to add more stress to parents when they're doing the best they can, right? But it's helpful information to guide some decisions.
They must know because we usually say that we as IBCLCs, we help the mother to take the informed decision. Informed decision, she carry the responsibility of the decision.
Mhm. Exactly. Well, thank you so much. Your contact info is here on the screen. So if anyone wants to
Thank
reach
you.
out to any questions, I'm sure you'd be open to that.
Thank you
Uh,
so much.
yeah, thank you. And have a great rest of your day. Thanks everyone for joining.
Thank you. Thank you so much. Thank you.